I'm Dr. Rita McGuire, and I am the Chief Medical Officer for Wakana, as well as one of the co-founders. And I want to welcome all of you. We've got a huge group on the line. We have an exciting topic. Please, if you're a panelist, you may want to limit your background noise because I'm hearing background noise. Don't want to lose any of you. But our topic tonight is about hair loss. And not only is it about hair loss, we're going to have our trichologist, Doris Mosely, really talk about what hair loss means, alopecia, different terms. We're going to talk about lupus. And we're going to talk about one of the autoimmune diseases that causes hair loss and can be one of the first signs. Hair loss can be one of the first signs of lupus. Last week, we talked about lupus. We talked about how CBD can enhance or assist with those who have lupus. So we're just going to spend the next 2 minutes in talking about cannabis, CBD. The next 10 to 15 minutes, we're going to bring on one of our business partners, and she is an RN, a registered nurse, who is heading up the lupus support group at Rush Hospital here in Chicago. Then the next 10 to 15 minutes, we're going to bring up our trichologist, Doris Mosely, who's going to talk about alopecia, hair loss, and specifically the ingredients in our product here at Wakana. And then lastly, we're going to bring up 2 very powerful testimonies from folks that are customers and business partners that have used our product, our CBD product, for hair restoration and healthy hair and alopecia. So that's going to be the lineup. It's going to be very, very exciting lineup. Want you to start putting your questions in that chat box because we're going to have a Q&A part after it's all done. So first, I must remind you an FDA disclaimer. These statements and products have not been approved by the FDA. If you're pregnant, nursing on medication, please consult your physician prior to taking any cannabis products. Again, there is background noise, and I think it's coming from one of our panelists. So if you are a panelist, can you maybe, thank you. Wakana is the name of our company. These are the 4 co-founders. Wanted to introduce you to our CEO, Melissa Boston. She brings over 29 years plus experience in the home-based business model, as well as she is the visionary behind Wakana. She's a social media strategist. She's built companies in over 40 countries. She's also trained over 50,000 distributors. So we are excited that the visionary is our CEO. Our president, Dr. Patricia Van Pelt, is a state senator. She has served her 3rd term currently here in the state of Illinois. She's an entrepreneur, businesswoman. And Phyllis Nash, our Senior VP of Sales, also brings over 30 years experience in a business as an entrepreneur, real estate, as well as the restaurant business. And myself, Dr. Rita McGuire, I'm Chief Medical Officer. I bring to you over 30 years as an obstetrician gynecologist. What in the heck is an OBGYN doing in the cannabis industry? But absolutely am an advocate for this plant in introducing a holistic and natural way of healing of my patients. And so our whole mission and vision, because Wakana is much more than a CBD company. You have to understand we are a movement, and our vision is that we exist. Our vision is that we exist to help end the negative stigma. Because I'm telling you, when you say the word cannabis, people think negatively about what it can do for their health and even the wealth benefit from this industry. Our mission is that we are the catalyst to stir a movement that inspires people to confidently move into the legal space as entrepreneurs, formulators, and investors, evoking the courage and strength of people to take back their health, wealth, legacy, and freedom. So let's look at the plant, because what we're going to be speaking on this evening is the hemp species. We know that the cannabis plant has over 100 plus compounds or cannabinoids. Now, the two compounds that you may have heard of, or maybe you haven't, is one THC, and THC is the part of the plant that gives you the high. It gives you the euphoria, it gives you the paranoia, right? It gives you the psychoactive component. But CBD, what we're going to concentrate on tonight, is the non-psychoactive part of the plant that gives you the health benefits without the high. And that is something you have to understand, is that we are speaking of the species, the hemp species, that gives us the health benefits without the high. So the difference between marijuana and hemp, well, marijuana has high levels of THC and low levels of CBD, and hemp has very trace amounts of THC and high levels of CBD. So we understand that CBD is an abbreviation for cannabidiol. It is very, very commonly found in most strains of the cannabis plant. It's the second most common compound in marijuana, but it's the #1 compound found in hemp. I've been using CBD in my practice for the last 3 years in conjunction with formal pharmaceutical, traditional ways of addressing health and wellness, but absolutely now have used it in conjunction with formal treatment. So when we look at CBD, we're going to concentrate on CBD tonight and its medicinal properties as it relates to inflammation, because CBD is a powerful anti-inflammatory. We're also going to look at CBD in providing antibacterial components, as well as relieving pain and anxiety. And the reason why, and the last one is reducing the function of the immune system. Because when we talk about autoimmune diseases, when we talk about inflammation, when we talk about hair loss, which is alopecia due to an inflammatory response going on, and many other responses, CBD has been proven to be an anti-inflammatory and antioxidative. It's rich in fatty acids, which we need for our hair growth, omega-3 and omega-6, as well as being an antibacterial and helping to reduce the immune system in hyperreactive states like lupus. So how does it do that? How does CBD work? How does it do all of that? It sounds like a snake oil, right? It is not a snake oil. There is true science behind how cannabis and the other cannabinoids work, and that's through the endocannabinoid system. This system, its overall role, main function, is to keep our body in balance or homeostasis. So this system is looking for cannabinoids that our body makes, endocannabinoids. And when those endocannabinoids that our body produces are deficient, well, that's when pain occurs, inflammation occurs. Our body is out of balance, it's out of whack. Our immune system is everywhere. So this system helps to regulate and modulate inflammation, pain, our blood pressure, our sleep cycle, our pulse rate. All of these receptors that are in our body that are looking for CBD are receptors found in our brain, our central nervous system, receptors found in our immune system, our periphery, and receptors that are found in every single organ and gland in our body. And this is going to really become important to understand, because when we look at lupus, it attacks every single organ and gland in our body. So these receptors that the endocannabinoid system that's found in our eyes, in our lungs, our liver, our kidney, our bowel, our skin, our stomach, our teeth, our heart. All of these receptors are looking for CBD. So what is an autoimmune disease? Well, to put it very in probably grammar school language without being really technical, it is a condition where our immune system mistakenly attacks our body as being foreign. And so this is why we see autoimmune diseases like rheumatoid arthritis and lupus and Crohn's and Graves' disease and multiple sclerosis, and you see alopecia on there and psoriasis. All of these conditions are attacking organs and glands and parts of our body as being foreign. So lupus is estimated that 1 in every 200 Americans live with lupus. There's no cure for this autoimmune disease. It's a very, very debilitating disease to have. Folks that have lupus have joint pain, fever, fatigue. They have something called a butterfly rash on their face many times, appetite loss, photosensitivity, and hair loss. Lupus attacks every single organ and gland, from the skin and hair, the heart, the kidneys, the joint, the muscles, mental, cognitive, psychosis, seizures, fever. It attacks the lungs, the blood, and even the mouth. So you can see how important it is that the endocannabinoid system has receptors in all of these parts of the body that lupus can attack. There's treatments. We talked about those treatments last week. There's medications. In fact, one of the medications, Plaquenil, we talked about last week, is now in a shortage for folks who need it. Why? Because they're using Plaquenil for COVID-19 patients, even though there's no data that shows that Plaquenil, which is needed by patients who have lupus and rheumatoid arthritis, it's been proven that it really does help their condition. So CBD is a safe and effective option for those who have lupus. Why? Because CBD is a powerful anti-inflammatory. And we see that the immune system in lupus is overreactive. It's also been found in data that CBD helps with pain and inflammation. It helps to interact with the receptors in the brain and the immune system. So we see here how CBD can put the immune system in balance. If the immune system is overactive, like in autoimmune diseases, if it's underactive in those immunocompromised conditions, people have cancer, HIV, etc., it puts the body back into balance. So now I want to bring up our first guest. You might have met her last week, but LaShon Gurrola is a registered nurse. She's also a lupus patient. She is heading up the lupus support group here in Chicago at Rush University. She is a transitional care nurse, as well as she is involved heavily in community health. She's a surgical nurse, and she wants to now share her story. And so we are going to bring up first Nurse LaShon Gurrola. Are you out there? And she probably is, but I muted her. Are you out there, LaShon?
I'm here, Dr. Rita. Can you hear me?
I can hear you.
Thank you so much for having me. Good evening, everyone. So some of you may have been on last week where I talked about my lupus diagnosis 10 years ago. So tonight I want to share with you my lupus hair journey. Dr. Rita, did you want to pull up my slides?
Yes, can you see them?
I cannot. I just see my my headshot and my CV.
Got it.
Thank you.
I will pull them up now.
Okay, so everyone, I want to share my lupus hair journey, and I must say that I'm currently still on this journey. Although I was diagnosed with, thank you, Dr. Rita. Although I was diagnosed in the year of 2010 with lupus, I can say that my hair actually didn't start having an effect until probably 2018. So obviously pre-lupus, I had like a full head of hair, nice length to my back, very healthy. In my early part of my lupus diagnosis, in the first couple of years, I could see some early medication changes. At that time, I think I was on the Plaquenil as my maintenance drug, as well as prednisone as needed. At that time, because my hair was relatively healthy and I was getting regular maintenance at the salon, I just really did routine shampoos, regular salon visits, vitamin D, and vitamins. Can we have the next slide? Dr. Rita, may we have the next slide?
I changed the slide. You want the next
Thank you.
slide?
Thank you. No, can we go back one? Thank you. So as Dr. Rita stated, lupus is an autoimmune disease where the body more or less self-attacks. So that's just the basic elementary term for that. It is an inflammatory disease and it can affect any organ on the body. The largest external organ on the body is the skin, the integumentary system. Lupus can cause hair loss. It can cause rashes on the skin, lesions. And with the hair loss, there are typically two types of hair loss, scarring and non-scarring. And I think we'll hear a little bit more about that later from one of our panelists. So in these photos, it's just really showing my hair back then. And we can you can see a nice length. You can see it's full. And I miss my hair. I could even actually pull it over into a side ponytail at some point. Thank you, Dr. Rita. Okay, so some hair loss from inflammation is reversible. It all depends on what's going on with you and what your situation is. If we're in remission, and so for those of you on the call, remission is where the disease is inactive. I mean, once you have lupus, it doesn't go away, but you can be in a quiet, non-active phase that we call remission. And then when we're flared up, we call it active. So based on your remission or active status, based on your treatment being your medication regimen, and whether or not your follicles are damaged or undamaged. Discoid lupus is a special, well, not a special lupus, but is a lupus that mainly attacks the skin and the scalp, that can leave blisters, lesions, rashes on the skin, scars on the scalp. This type usually will cause follicle damage. And usually with this one, hair loss is probably more permanent. The thing with having lupus, the medications in themselves cause hair loss. And it's often a battle with trying to find the right mix of medication treatment. You know, I'm always afraid of going too high on doses because of the hair loss, but then also the medication can keep the flares down enough to prevent hair loss. So it's always like a balancing act.
Okay, so people are saying that they can't see the slides.
Mm-hmm.
Are you guys seeing the slides?
Now we are.
Just
Yes.
deleting the screen.
Can we go? Okay, next one.
Do you see the slides now?
Yes.
Covered that one. Next one. Okay, so on this is where my hair loss journey really began, is in April of 2018. So I just really woke up and I had no hair in the top of my head, basically. This was very traumatic for me, causing a lot of anxiety, a lot of depression. When I look back and do like a tracing of history, I had a significant lupus flare in the fall of 2017 that required 7 days in the hospital, followed by another significant lupus flare in January of 2018, requiring another hospitalization for about 4 days. So back to back, these two flares just kind of threw me off kilter. And so, can we go to the next slide, Dr. Rita? This is what I woke up to. If you can see this picture right at the crown, I have basically no hair. I had my edges, I had the back, but this really traumatized me. And I know, I'm thankful to be alive. I'm thankful that I got stable. But you saw the pictures before of what my hair looked like. So this was, I went through a grieving process, more or less. Next slide, please. This is just a different view of the same one, just showing more of the back toward the top back. Next one. So what do you do? What do you do when lupus has taken over your hair? I have two stylists that I've, in the last 25 years, only 2 people have ever touched my hair. And I did reach out to both of them, and they both had different suggestions for me. I wasn't quite ready to go with a full wig. I didn't know, one suggested like sew-in and something called like a front lace. I didn't know what that was, and to be honest with you, I still don't. So I opted to just do what we call like the ponytail, the phony ponytail, to try to give the top of my hair a chance to rest and let the medication work on reducing the flare. And then I just checked in with my dermatologist and rheumatologist to kind of get their way in. Now the rheumatologist wanted to increase two medications. At that time, I wasn't in agreement with that plan. I kind of felt like I was stable from the last discharge in January. So I didn't want to up the medication because other than the hair loss, I wasn't having any pain, any other symptoms. I wasn't running fevers. I wasn't having the night sweats. I wasn't having any rashes. So I just wanted to hold off on the medication. Next slide. Thank you. So the best thing for hair loss, from my experience with my journey, was to keep my lupus managed with the medical regimen. And we already talked last week about supplements to that. I do use vitamins. Biotin is a big one for hair, the skin and scalp vitamins. I've done urotherapy. And at one time, I considered PRP injections, platelet-rich plasma. Those are very costly, and I was afraid of getting scarring on my scalp because I have a history of keloids. So a lot of African Americans have skin that keloids. I had three C-sections, and each scar, each incision keloided. So I was afraid that if I did that procedure, I would get scars in my scalp that would damage the hair and damage the ability for me to have a regrowth. I thought the follicles would get damaged, so I didn't do that. And again, we talked about the balancing act. So do you worry about your hair? Do you worry about the medication? Do you adjust the doses and go higher? Because a higher dose can possibly prevent a flare, but the higher dose can also contribute to more hair loss. Next slide. This is a little blurry, and I apologize for that, but this was one of my stylists, LaShon Griggs, was very patient with me. I didn't know what to do with my hair, so this was the first clip-on ponytail that I did to just kind of, I had to go to work in 2 days. You wake up bald-headed at the top, and you've got to work in 2 days, so I didn't know what to do. So this is gonna give me some thinking time and some recovery time and some mourning time, mourning the loss of my hair, and still have something that I can look professional when I'm talking to patients and talking to physicians, that they're not staring at my hair, but they're focusing on what I'm saying. Next slide. Again, we come up with tricks for our hair. And in this style, I still had no hair at the top, but this bandana covered from the front all the way to the back middle. So nobody was obviously able to see the bald spot. And then this again, as I'm using the treatments and using the scalp stimulator, I'm able to give my hair some kind of breathing room without having the ponytail all the time. Next slide. And this is me again, If you can look at the front is actually getting thicker in this one because I was using those vitamins and that scalp stimulator, but I just actually put a different type of clip on just to give myself some pizzazz for some type of event I was going to. Same one, just a different look. So with lupus hair, our hair is very fragile, is very, most of us, not all of us, but very thin, fragile, easy to break off. So it's best to kind of stick with simple styles. Do your best to protect your edges from tight traction ponytails and updos. So always kind of leave the edges loose. Obviously, regular shampoo and conditioning, gentle scalp massages to stimulate the blood flow. Lupus causes our edges to break off easily, and there's this term called lupus hair. So a lot of people with lupus have this lupus hair where you can see that our edges look kind of at times raggedy, or it looks like we're not like getting regular maintenance, but we are. It's just that the break-offs occur sometimes every other month. It's just hard to manage. When this hair loss occurs, as you've heard, it's called alopecia, and we'll hear a little bit more about that later with Doris. Next slide, please. So in the last set of photos, I was just showing different ways to, you know, kind of camouflage the bald spots. Thank God I had enough hair on the side to actually pull it up over. And one of my stylists, that was LaShon Griggs, who taught me how to do that one. Okay. Lupus is very complicated on the hair. So this is where you're going to have to pull your medical team in, your dermatologist, your rheumatologist, trichologist, your hairstylist to kind of develop a plan for you. Supplement your hair support plan. A hair support plan is what you have in place for your hair, but you might want to add some supplementation to it, hence the scalp stimulation to help protect your hair, like the hemp power from Wakana. Keep your body in balance with CBD, which we just heard about that from Dr. Rita. Stay on the medical support plan because it's very key. Staying medically stable to help reduce the flares will in turn help your hair keep getting attacks, because with each attack on an organ, there is no rebuild or recovery, if you will. Like you get organ attacks on lung, liver, heart, that doesn't come back. Hair support plans can take up to 6 months. So if you're trying a product, let's say a scalp stimulator, don't expect and don't get discouraged if you don't see results in 2 weeks, 4 weeks, 1 month, 2 months. Sometimes it takes 4 to 6 months to actually see a benefit. Next slide. I made the mistake of stopping something that was working. So if your hair support plan is working, when you see some results or you achieve your desired results, don't stop the plan. Continue it, even if it's at a maintenance level. Maybe you don't need it every day, but I would recommend continue it 3 times a week to just protect yourself, because we need to still protect ourselves from flares. Every time we have a flare, we have the potential to lose more hair. My current support plan includes biotin, vitamin D, vitamins, the nail and hair vitamin, the hemp power hair. There are 2 ways to use that support, and that is as a tincture under the tongue or directly on the scalp in the affected area. I use it directly on the scalp in the affected area. I gently massage it into the scalp. Depending on how far I am into my next shampoo, or if I have an event or somewhere, because that liquid, I have kind of thick, coarse hair. Doesn't look like, not thick, but it's coarse if something wet gets on the roots and dries. So sometimes I'll mix it with like a carrier oil, something like coconut oil or castor oil, just a small amount, just so I can spread it without the wetness dripping into other areas, and then I'm not having wet hair. Next slide. This picture is just showing a now. This was last week. This was last Sunday. Next slide. This was last Sunday, and it's just really giving a top view of my hair. But if you notice, I still have the bald spots there. My stylist usually, I have enough hair on the sides to kind of pull the curls over per se. Next slide. Now this is without that pullover. So this is what I'm working on. This is my hair journey right here. Okay, this one, this is after using product. Now you can see that the top and the front have come back. And that's using my hair supports plan. Next slide. This was last week, Dr. Rita. We couldn't get me on video, but this is what I look like. This was taken that day. This is 3 weeks with using the hemp power hair. And on this one, you probably can see the shine. Right now, it's kind of too early to tell things, but I see that shine right there. Next slide.
Yeah.
Okay, this is today. Today, my stylist, Fatima Massey, came over. As you know, salons are closed, so she did a travel visit for me, had my hair shampooed. As you see, it's very thin and weak at the top, so I'm still working on this hair journey with this lupus. Next slide. And then this is how she styled my hair. So I can do a little bit of cover up at the top, but obviously it's still noticeable. So if I was going to, say, a wedding or some fancy event, I can do clip-on hair just in the top just to give it a fuller look. So today I would, if I use hemp power on my hair, I don't want the curls to necessarily get wet. So this is a day I would mix it with a little oil and slide it in between those parts where the curls are and massage it in. And then my hair looks like it hasn't been touched, and then my curls are lasting. Next slide. To my wonderful stylist, this is the one who has that technique with that styling. Next slide. LaShon Griggs, who was very patient. They both were very patient in working with me with trying to get this hair journey, and they both are still with me on this journey today, and they support my intent to keep my hair as long as possible. Next slide. So my hair support consists of this right here, and people may ask, well, why do you have the lotion there and gummies there? I have a lot of anxiety and worry about my hair sometimes. I know I need to reduce that because extra stress and extra worry can cause further hair loss. So that's where my CBD products and my gummies and the tincture will come in to kind of help with that. But overall, just keep me in balance. That mango we talked about last week, that mango cream, I love it for my skin, and I will put it around my edges right where it meets my skin. And then we have the hemp power. Next slide. Thank you. And these are just my other regular stuff that I use as a part of my hair support plan. Coconut oil, castor oil. And these, not every day, these things, these are just other things that I use for my skin and hair. Next slide. And that is it. And I think we're saving questions to the end. Thank you very much.
Thank you so much, LaShon. What an amazing journey that you are on. Thank you for sharing that journey with us. Thank you for being so transparent about, how this has affected your life and the things that you're doing to change these issues or challenges that you have as it relates to lupus and hair loss. So we are going to address all the questions at the end. I'm going to bring up Doris. Doris, let me first get your slides, and then I will give you a proper introduction here. Let's see here. Can you see that slide now?
Yes.
Okay, there's nothing in front of the slide.
No.
Wonderful. So this is Doris Mosely. Doris Mosely is an accomplished cosmetologist. She's a certified trichologist, hairstylist, entrepreneur, and educator, inspirational speaker. She is truly an icon in the hair industry. She is currently in California. She heads our hair division here at Wakana. And I want to introduce you to some, and many of you know her from our certification, Doris Mosely. Take it away.
Thank you, Dr. Rita. And I just want to say I am very excited to be on the platform with you tonight and all the other speakers. This is amazing. And we have really just have not been in tune to what is now become an epidemic, and that is hair loss. And it's so many reasons why. And LaShon, you did an amazing job. And I just want to applaud you for not going with the weaves and all the different stuff people was trying to get you to do, because you would have only made your situation a little worse. So great job not doing that. And Dr. Rita, you can go to the next slide. So alopecia, you heard LaShon talk about her journey with alopecia. Alopecia is really a complete absence of hair from areas of the body where it normally grows, and we know it as baldness. But alopecia can be very devastating, and tonight we're dealing with alopecia from a lupus standpoint. Androalopecia, which is male pattern baldness, female pattern baldness, and when you have, and also alopecia areata, which is an autoimmune deficiency, and which you have hair loss and patches. Traction alopecia is hairstyling. It's the technique in which you apply hair or you do tight, stressful things to the hair. And that's what I'm so glad LaShon didn't do, because again, it would have just made hers a little worse. And as we say, are you familiar with follicular hysterectomy? Once there's a follicular hysterectomy, then that is permanent hair loss. Once the follicle is dead, there's nothing else can be done. Now, if you look at the screen now, at the top, you have the male pattern baldness. Male pattern baldness usually starts in the front or in the very top, and it spreads out. And in the end, there's no hair on the head unless they have just a little bit around the hairline. Female pattern baldness, and that's how it progressed. If it's not dealt with, it'll progress to this point. And most of the time, it is in the genes. And then the second row is the female. The female, it starts in the top, spread out, and usually the hairline is still intact. So, but if you don't pay attention to this, and most of the time it is missed in the salon, because once you get to age 40 and above, you start losing hair a little more than you normally, and hair goes through a growing process, which I'll share that with you. But if you don't pay attention to this, you can end up just like the pictures here. So we want to make sure, as coming from a stylist perspective, we have to be more aware of what's going on our clients. Now, this particular picture here you see on the screen is traction alopecia. Traction alopecia is where you have placed the hair, you have stressed the hair out. You put too much tension on it, and usually it happens around the edges, but it can definitely happen in the top of the head and anywhere over the head where the hair is being stressed out through pulling. Again, some hairstyles, including tight ponytails or braid, from being pulled from the scalp with such force that hair strands are damaged, fall out. In most cases, hair regrow after you alter the hairstyle. But some cases, it can lead to permanent hair loss if you do not pay attention to that. And then we go into alopecia, the three types of alopecia. We have alopecia areata, that's where you see the patches. Alopecia totalis, that's where there's no hair on the entire head, and sometimes the eyelashes and eyebrows are affected. And then you have alopecia universalis, when there's no hair over the entire body. Now, we are born with over 5 million follicles all over the body, but about 100,000 of those make it to the head. How you deal with those follicles is how you will end up with hair. Unless, in LaShon's case, she ended up with lupus, and most of the time it is diagnosed late and you don't get ahead of it. This is how hair grows. Hair grows through 3 phases. It grows through the anagen phase, which stays in that phase about 2 to 7 years. Now, if you end up having hair loss is in that phase, in the anagen phase. Then you have the catagen phase, which is in the resting stage there. And then it goes on to the telogen stage. Now, this is where, if you notice at the bottom where blood is being supplied, well, if blood stopped being supplied to that strand, by the time it gets to the telogen phase, it's shedding. That's normal. Shedding anywhere from 50 to 100 strands a day. But if you're in some of those stationary hairstyles, it's still shedding, but it's not coming off. So when you get ready to take it down, you have all of this hair that would have came out anyway, but you didn't get it out because you didn't comb it for 2 months or however many months you had it up. You didn't brush it. It just kept coming out like it would normally, but it didn't get out. So that's important because now you have the blood supply is no longer there. That strand is gone, but it's happening simultaneously. It's not like one day you wake up, no hair, the next day you wake up with hair. No, that's not how it happens. It simultaneously, it goes from anagen, catagen to telogen. Telogen is normal shedding. Excessive shedding is become telogen and fluvian. That's when it's excessive. That's when you need to really go and have it checked through a dermatologist or your endocrinologist, someone that can check your blood to see what's going on, because your hair is the barometer of the body. It lets you know something is going on inside the body. And most of the time, if you end up with an autoimmune disease and they diagnose it late, then that means you have just that much hair that you would have lost if they had caught it early. And I was sharing with Dr. Rita earlier, I had the opportunity to scope and analyze scaps at an event. And this one young lady, she had about the size of a quarter that was missing. And I asked her, I said, what happened to your hair here? She said, my hairstylist took my hair out when she took my weave out. Now, if you don't know what a weave is, it's the hair that they put on the head on top of braids and sew it in. And I said, well, I think you should go to a dermatologist and have them to check this and even ask for a biopsy to see what's really going on. Now, I'm not a doctor, so I couldn't diagnose, but I could tell something wasn't right there. That's the knowledge of a trichologist. I can tell something wasn't right. So I said, you should go. And she said, okay, I will. I'll check it out. What she did, it wasn't a client of mine, so I didn't really know to keep up with her after that. But she called me and she said, guess what? I said, what? She said, I was diagnosed with lupus, first stage lupus. Now, if you could imagine, she had not gone to the dermatologist to have that biopsy, she wouldn't have known that. She would have continued to believe that her hairstylist took her hair out. So now with that early stage, early diagnosis of lupus, she was able to get in front of the lupus instead of behind it, so she can kind of slow it down if there's a such thing as slowing it down. But she was so blessed and she was very grateful. Now there's different causes of alopecia. It's genetics, some medication, stress, age, and poor nutrition. Genetics is when your mom and dad had that challenge. And some medication, just like LaShon was saying, she had medication that just speeded up her hair loss. But, you know, and you don't want to take that, but then you're going to say, well, do I deal with the illness or do I deal with, I'm losing my hair? You have to, sometimes you have to make a choice. But I think I'd rather deal with the hair loss and then deal with the illness. I'd rather get the illness under control. Stress, again, stress plays a major part in hair loss because you have chronic stress, you have traumatic stress, and then again, traction alopecia is stress. Excessive brushing, believe it or not, can cause stress to the hair, although brushing helps stimulates the blood circulation. And when the blood is good and circulating properly, your hair growth is better because that's what nourishes the follicle. It's your blood. Then age play a part because once you pass 40, hair you start to be less and less. And by the time you realize 51% of it is already gone. So you have to really pay attention to the body. And as Dr. Rita said, a CBD brings the body back into balance. And poor nutrition, I know we're guilty of that right now. We're all stuck in the house, we don't know nothing else to do. And so, you know, Dr. Rita probably getting on all of us about that because that's important. We have to give our body something that is nutritional and keep our body in alkaline state and keep it hydrated. The disclaimer, this product should be used only as directed on the label. This statement has not been approved by the FDA. This product is not intended to diagnose, treat, cure, or prevent any disease. Should any irritation occur while using this product, please discontinue use and seek medical attention. Results will vary. Some people, depending on the way your body is, you will get better results than others and faster results. This here, and I can't, yeah, okay, we have a Wakana hemp-powered hair. Hemp-powered hair have different oils. The hemp seed oil, of course, is our CBD. Now, I am so excited about the fact that Wakana researched oils to bring together that will work directly on hair restoration. And the hemp-powered hair energizes the hair follicle, stimulates faster, thicker, and longer hair. Now, I'm not saying, and I'm glad LaShon didn't say it happens overnight. You have to have patience. I hear people saying they got something that'll grow your hair 2 to 4 inches in 1 month. Hair grows a half an inch to an inch a month, 6 inches a year. That's the average. So we're not promising you no miracle. We're saying stay with it, give it at least 6 months and see what happens. I did, and it happened. My hair is back. Next slide. Blackseed oil. Oh, this is one of my favorites because it's inflammatory. Now, inflammation is one of the leading causes for hair loss. So if you got the black seed oil and it's in hemp-powered hair, you're all on the way. It kills fungus and it thickens the hair. And it also helps with the itchy scalp. If you have an itchy scalp now, let me share something with you. A lot of time you have itchy scalp, there's inflammation there. And let me share with you about the myth. Some people say, my hair, scalp is itchy. That means my hair is growing. That's a myth. You already first stage lupus. If it continues to itchy, you need to go see a doctor. But black seed oil helps in that area because it kills fungus. Next slide, please. Baobab, I didn't realize it was on the next slide. Baobab. Baobab comes from the tree of life in Africa, rich in vitamin, and I can't see that slide. The pictures are blocking some of the writing, Dr. Rita, our pictures. So if you can move it over, if you can move the slide over.
It doesn't move. It's rich in vitamin A, D, and omega-3, which all trigger hair growth and increase.
Okay, and increase moisture. That is important. You have to keep your hair moisturized, but not over moisturize it, okay? Because hair is made of 2 things, moisture and protein. So you can over proteiниze and you can over moisturize. So Baobab has the exact, what we need for the exact effect when it comes to the hair. We have the pumpkin seed oil. It's rich in vitamin, and I can't see that.
Vitamin E and zinc.
Zinc is very important because what happens with zinc, it the tissue grows. It's just like help with the tissue growth and repair. Without it, it can cause hair loss, becomes deficiency, and it's a supplement which reduces hair loss. So it's very important that zinc is in pumpkin seed. It also, pumpkin seed helps with DHT. Now, I don't know if you're familiar with DHT, but it's dihydrotestosterone. And the pumpkin seed help block the DHT from around the follicle. And what happens with DHT, it wraps around the follicle and it chokes out the nutrients. And when it chokes out the nutrients, just imagine if somebody was choking you and you got no nutrients, you got no oxygen, you will eventually die. And that's what happens with the follicle once DHT wraps itself around the follicle. So that's important, you guys, that you know that when Wakana went after the hemp-powered hair for restoration, they researched the product, they researched the ingredients to make sure it was doing what they say. And again, rosemary oil is another one that helps with DHT. It's a natural DHT blocker. So it's very important that you know what you have in rosemary. And it helps thickens the hair also, and it helps improves the hair. And very, very good for the hair, rosemary oil. Moringa. Moringa is good for the overall body health. It's overall good for the entire body. And biotin is one of the strong vitamins that's in our moringa oil, which is absolutely good for hair growth, for restoring the hair. Wild salmon oil. Wild salmon oil, omega-3s, helps with the strength of the hair and help with the shine of the hair. And that's a natural, because you can't eat enough salmon to make the difference. So it's very good for that. It's protein for the hair. It helps promote healthy growth. And again, having all of these oils in hemp powered hair only just addressing the restoration of hair. Very strong, very healthy, and it's very good. Peppermint. Peppermint, another one of my favorites because it stimulates the blood circulation. And when you have a client or you in the shower shampooing your hair, it helps the aroma from peppermint just relaxes you. And when it relaxes you, it allows the blood to flow. And it's an antimicrobial ingredient also. And it stimulates, and when it stimulates, it increases the blood circulation. So it's very good. Lemon oil, it helps cleanse the hair. That's one good thing about lemon oil. It helps promotes healthy hair, which is crucial, and it helps fight bacteria also. It also cleanses the cuticle layer. The cuticle layer is that outer layer of the hair. And when you cleanse the cuticle layer, that also helps brings up a good shine, because if you're not cleansing properly, you're only conditioning over conditioner. And so that's real important. Powerful product. Features: proprietary blend inclusive to Akana for life. More than a dozen powerful oils, carefully formulated with the right ratio of ingredients for maximum results. It's been tried, it's been trusted, and it's proven. I am a product of the ingredients that's in this product. I was diagnosed with CCCA, which is in the top of my head. It was central. I was losing my hair. Centrifugal, it started to spread out. Cicatricial, it was scar tissue, alopecia. But the ingredients in hemp-powered hair saved me. And it was formulated, enhanced with even more powerful essential oil. You purchase the product, examine your scalp, follow direction, eat a healthy and balanced meal, take before pictures. This is how you, just like LaShon did, you chart your journey. If under doctor's care, if not, you should seek your doctor first. Healthy hair can grow at least 6 inches a year. Take after pictures, share your results. I had another client that came to me, someone else referred her, and they kind of shared with me what to expect when she got to me. Well, when she got to me, she was a lupus client, and she had discoid lupus, where she looked absolutely like a burn victim. Even in her face, even in LaShon, you look nothing. And you should be very blessed like this client. And she had hair only in the back, 2 by 2 inches of hair in the occipital area. When I took her hair off, this is the first time I ever serviced her. It scared me so bad. I left her, went into the office and called the dermatologist, which is a very good friend of mine. And I asked her, first of all, I wanted to know, was it contagious? I had never seen a lupus person. She said, no, it's not contagious. And the person who recommended her to me had told me how people had been treating this client. So I went back out there and I embraced her. And to this day, it's been over 10 years, she's still a client. And I was like, I just loved on her because what she was going through, and she had makeup on that was so heavy that it camouflaged her skin, her face, but her head looked like she had been burned. She had discoid lupus, but somehow it didn't get diagnosed in a timely manner. And she had permanent hair loss. So now she wears a full wig because she definitely wouldn't want to wear a bald head out like that. So she wears beautiful wigs. She's a beautiful person inside and out. So stylists, if you're on the line, recognize things that are going on with your client, especially if they're having excessive amount of hair loss, they need to seek medical attention. So if they are having any autoimmune deficiencies, they'll be able to get ahead of that. We're not to diagnose it, but we are to refer them out. And that's very important. Itchy scalps don't always lead to just they didn't shampoo their hair. Itchy scalps could lead to lupus or any other autoimmune, because remember, your hair is your barometer of the body. It lets you know something is going on in the body. So take your time, analyze the scalps. Do not just jump into weaves and wigs unless it's absolutely necessary. They have fibers that you can sprinkle over the scalp. Get your hemp powered hair. Take it and put it under the tongue. Use it as a tincture twice a day, 6 drops, or on the scalp. Please do not let the nozzle touch your mouth or your scalps and hair, because it can contaminate your product. You don't want to do that. So it's very important that you take the hair journey. If you got clients that need to take the journey, get them into our hair. It does work, but to be patient, because nothing happens overnight. Thank you, Dr. Rita.
Well, thank you so much for that information. Oh my gosh, how powerful was that? I really, really pray that there are stylists on the line, because they may have questions for you. But we're just going to end with 2 powerful testimonies. I'm going to bring up the first testimony that we're going to hear from, and that is Tiffany. I'm going to unmute Tiffany. Just so she can talk.
Hello, can you hear me?
Oh, there you are. There you go, Tiffany.
Good evening.
Good evening. You can take it away. Can you see the screen of your hair?
I can. Thank you. Okay. Good evening, everyone. Again, I am Tiffany. I'm coming to you today with just great excitement and extreme transparency to provide my testimony about the Wakana CBD oil, the hemp powered oil, and what it has done for me. I first want to say how honored I am that Dr. Rita and the Wakana family has asked me to share my testimony and my story with you today, and how the product has truly changed my life and my outlook toward, my hair. First, I want to say that it has given me back extreme confidence and the ability to wear my hair in its natural essence. Second, it has rid me of the embarrassment that I faced for so many months due to my extreme hair loss. And as you can see in the pictures, these pictures were taken just to kind of show the damage that was to my hair. There was another picture, Dr. Rita, that I sent you that was a little bit more extreme. I don't know if you have that picture. And that was when I first started with the CBD oil, or like right at the very beginning when the hair loss was really, really bad. But I also want to say, thirdly, that it has allowed me the versatility now to wear different hairstyles, be myself more, and then also just smile when I look in the mirror and at my hair, instead of frowning and feeling disappointed. I first was introduced to Wakana and its products by my mom and dad, Ricky and Annette Faulkner, who are also Wakana distributors. My mom originally started using the hemp-powered oil on her hair and just kind of raved about how well it worked and how well it worked for her. And this little vow that Dr. Rita just put up was the vow that she gave me to try out the CBD oil. So I didn't have the full amount. I just had that little tube. And so I started using the hair oil from that, what my mom gave me back in, I want to say, that was back in February of 2020. However, I originally started losing my hair back in September or October of 2019. And it was due to me wearing some protective styles. And I had some box braids, and then also was dealing with a lot of stress around that time. And so it took my hair out tremendously. And then from once I gave the information to my mom about what was happening, she then gave me the oil. I started using that. And again, that was in February, the beginning of February. And I want to say around end of February, the beginning of March, I ended up purchasing my own oil because I had used all of the oil that my mom had given me. I'm sorry. Did you say something, Dr. Rita?
No, that's not me.
Oh, okay. I'm sorry. And so I started using the oil that I ended up purchasing from my mom. And then I want to say about the end of March and into April, I started seeing the tremendous growth. So this picture that's showing now here on this slide, this is after, this was around March when, in the beginning of April, when it started growing back in. So originally I had absolutely no hair there. It was completely bald. And so this hair, the oil started growing back. And then I took another set of pictures around April 17th. And then, do you have the next picture of me, Dr. Rita?
I don't.
Okay.
I have it. I don't. I'm sorry. I thought I put it in my slide deck.
Okay, no worries. But then I do have another picture that I sent to Dr. Rita today, and it's so much thicker now. They are all of where the thinning that you see on the screen has come back in completely. I do have a few areas that's still a little bit, I won't say bald because it's not bald anymore in that area, but it's still a little thin, but it is growing back. And I just have to give, thanks to this product. It has really helped, especially when I was trying other products and nothing was working. So I'm extremely grateful and thankful that I've had the opportunity to be introduced to this oil. So that's my testimony.
Thank you so much, Tiffany. I appreciate you sharing. We went back and forth today. She has a lot of pictures, and what's so great about Tiffany is that she's open to share them. So I will share them on our Facebook page so you can really see the area that was completely bald and where now we see the restoration of her hair from February to today. So thank you for that share. I'm going to bring up our last testimony, and that's from Minister Mooney. Minister Mooney, are you out there? Because we had to have the men represented, right? Men have hair loss as well, and so he's going to just give his testimony. Thank you so much.
Yep, can you hear me?
I can hear you.
Good evening, how are you?
We are great. This has been such an amazing discussion.
Awesome. Well, you know what? I want to start out by saying thank you for having me on the call. It is a pleasure. I tell you, it's an honor to be able to share testimony, especially when, the products work. So I'm going to be honest, I didn't believe in this particular product in the beginning because it was made for women. So you guys kind of left us out, and I was like,
it's made for men and women. That's why this is so powerful that you're giving your testimony, because yes, you thought it was just made for women, but
I thought it was just made for women because I was like, well, I didn't have, actually, I was particularly asking for a beard oil. I'm a bald-headed guy. So what you see is me actually taking a chance on putting it on my face. I think that's what the angle that I wanted to come from.
yes.
So I took the chance to put it on my face. And the reason that I did that, because Margaret Dorsey, she was having great results with the product when it first was launched right after the holiday. So I saw her, and then Ann, my lady, she actually bought the oil as well. So her having it around, I didn't buy it. I started being a little hard-headed and dipping in her oil. So I started putting it actually in my beard. And as you can see on January the 7th, that's actually, I always, when I go to the barbershop, I have my barber to take pictures of my beard. You know, it's just something that I've been doing since I've been trying to grow so I can see the difference. So January the 7th, right after that, I started using the oil, you know, sneaking in ads. I would say about 8 days after just starting to use it, it just started changing, you know, hair started growing in. And so I said, you know what, I'm gonna wait another 2 weeks, because there's a picture in the middle of these two pictures, but I didn't send you that. But I said I'll wait another 2 weeks, go back, get another trim, and there was a difference. So moving ahead, like by what you see, by February the 13th, that's how thick the beard was.
Wow.
Yeah. I mean, and the thing is, do you have my other slide?
Yes.
So this is the thing, if she could pull it up, that was really, nobody ever knew. We camouflage real good, right? So when you look at where I started, before I even started, I used to dye my beard, and nobody could ever tell. So when you look at the first row of the pictures going across where it says my row used to dye, actually, yeah, I used to apply $35 every month to dye my beard. So it would look like I had a full beard. And men are doing that. Men, they have hair where we can blow in our hair and blow in our beard to just camouflage. So I always wanted that full look. So when you look at what happened by February the 13th, my beard line was higher. So areas in which I only had a little, but it wouldn't get thick, it started getting tremendously thick. And what made sense was that Dr. Doris Mosely, when I looked at her and she first shared about alopecia, it was interesting because she said that it worked on the growth, or the formula worked on the cellular level. And being a cancer survivor, leukemia, chemotherapy, my hair structure had already changed to being very thin, including my beard, every hair on my body, you know, maybe TMI. But now when you look at that last row, I'm weird like that. Well, when you look at that last row, I stopped dyeing my beard because it got so thick. You guys, it's ridiculously thick. If you can, like, it's thick. So that's the journey. So I am gonna dye it again, but not to cover up. Maybe to just cover up some of the gray, because you guys, we're in the house. I'm not going to the barber right now. It's not gonna happen. But when this is all over, I can't wait to get my beard lined. And the blessing is that a lot of people have been noticing how thick my beard has been getting. So to share some couple other shares is that I started out sharing Ann's picture. She was just working on her edges, and her edges got real thick as well. So I started out sharing her picture and my beard picture. So people start asking, what is she using? What am I using? They saw Mama Doris. We started sharing pictures, and people start ordering this stuff like crazy. And even they got results. And the average results the initial results was in between like 8 to 12 days, the average results. So then one last testimony was, I met I run another business where I had to deliver packages and deliver them drop them off at the post office. So I had to go to a location. I won't disclose the location because I don't want to share the person. But she was dealing with some type of sandburn, and no hair up front, a lot of hair in the back. So I had pictures in my phone, of course, my own, and Dr. Mosely had shared her slides, which I took pictures of it, that mentioned the word alopecia. I didn't know what the male lady was dealing with, but as I walked to the counter, I whipped around my phone and I asked her, did she know this word, or did she? And I showed her my pictures. Was she having this experience? And she said, oh my God, you know what? I've been trying to grow my hair for 2 years. What is it that they're using? So I sold her the oil. She ordered it online. She bought it. And I would say in about 2 weeks, this woman could not grow her hair in 2 years. In 2 weeks, she sent me her picture. And from bald to like little strands of hair, I was like, oh my God. And this was probably about a month ago. So I'm waiting for the rest of her results, but she was extremely happy. One thing that I realized, last thing, is men, we've been jerks. And I had to say this to Ann because Ann used to always kind of mess with her hair. And I'd be like, babe, stop messing with your hair. Or men, we're so visual that I'm gonna be honest, I've been a jerk. I've never really paid attention to what Tiffany mentioned, which was the embarrassment of having to having maintenance and having to hide. I never really understood it. But then I saw a Madam C.J. Walker movie, and then I just paid attention, started paying a lot more attention, because now I was as a man, sharing with women and approaching them on how I could possibly help through our product. And I found myself apologizing for being a jerk because I never really knew what a woman dealt with regarding her glory. So on that note, it's an honor to be able to share this product. It's an honor to be able to help people in this space. If you're listening to me, I spent $35 on dye, but this product is like $49.95. It's worth at least trying. So love you all. Peace.
Wow, powerful, powerful shares. Thank you, panelists. I'm going to take questions, so stay on the line because there may be some questions for everyone. Let's see here. Wonderful job, Doris. I'm going to get some hemp-powered hair oil too. I've had increased hair loss since entering menopause. It's not very noticeable to others, but I can tell you it makes me uncomfortable. Shout out to my sponsors, Ricky and Annette, that's from Grover. Tiffany, are you able to show us your hair on your video feed to see up-to-date results? Yes, I will share that on our Wakana for Life Facebook page. This is a question for probably Doris from Trina. I have alopecia. I was diagnosed in 2018. I saw a dermatologist, and the dermatologist could not tell me why. No lupus, but I am anemic. I've had cortisone shots, which saved some of it, but I have scarring. There is hair, but it's patchy and some significant balding at the top and sides. Losing my hair was traumatic, and I'm on the brink of shaving it. I was told to use Rogaine, castor oil, and beautiful bamboo vitamins. Some has grown back, some won't grow back. So I'm wondering if I should try hemp-powered hair. What is your response, Doris?
Oh, yes. You know what? If you are an anemic, that means you have iron deficiency. And yes, hemp-powered hair definitely is good for you because you need to get the oxygen and get the blood to your follicles. So yes, very good because of the hemp oil, that's hemp seed oil that's in our hemp-powered hair. It's just going to get the body back into balance. So yes, it's a great product for you to use.
Let's see. Awesome, awesome, great job. Awesome, awesome. Everyone says awesome. They're going to share this information. Alopecia, 90 million women are affected by hair loss. It's an epidemic. Thank you. Great job, awesome job. Are the slides explaining the hemp-powered hair available for me to use? Yes, they are. I have severe hair loss. I'm making my purchase tonight. Oh my goodness. All of these comments are just stellar. Awesome, awesome, awesome job. Thank you so much, everyone. I don't see any other questions. I see a lot of great comments. Here's some questions. But if we could just have some closing remarks, you know, Doris, will let you go first. Give some closing remarks on what you would recommend to our listeners. Tiffany, I'll give you closing remarks, Minister Mooney and LaShon, and then we'll call it a night. Please contact the person that invited you on this call because we want to get your products ordered. So Doris, I'll let you go first.
Yes, just keep in mind, you guys, that hair loss is right now at an all-time epidemic. Over 80 million people are losing hair, 50 of men and 30 of women and their children. I just seen a question on the screen that would it help with hereditary hair loss? Yes, get on it, get ahead of it, okay? And it should help you because of what's in it. And just be patient. Nothing happens overnight. I say this all the time. Hair grows anywhere from a half an inch to an inch a month. That's on the average, 6 inches a year. So give it at least, like Willie was saying, 6 months. You want to give it at least 6 months, as LaShon was saying also. You get results before, be excited about it. But please just hang in there with it. Make a decision tonight to get started and don't look back.
Thank you so much, Doris. Another question I see is about the eyebrows. I've seen so many people put it on their eyebrows, their beard, yes, to get those hair areas of the follicles healthier and thicker. So yes, eyebrows, yes. I'm gonna let Tiffany give some closing remarks. Tiffany?
Hi, okay. Can you hear me?
Yes, I can.
Okay, great. So my closing remarks would be to this hair oil is amazing. It has truly, truly, truly changed my life, the way that I feel, the way that my hair looks. The ability to be able to wear my natural hair again has been nothing but amazing. I thought at one point that my hair was just damaged forever. Using this oil has truly redefined those odds. And so I would just say for those out there that's listening, for those that are listening that know someone that could benefit from this oil, to definitely recommend it. My testimony has been pure and true. My pictures have been transparent because I want you guys to see the beginning to the end of where I started to where I'm going. And I know that you would definitely benefit from this, and I highly, highly recommend it. I will continue to be using this oil and definitely spreading the word about it as well.
Thank you so much, Tiffany, for your testimony and those closing remarks. So the bottle, if you're using it just orally, will last you a good month. If you're using both oral and topically simultaneously, then it's going to last you a little less than a month, maybe about 2.5 to 3 weeks. So again, it is a power product, which means it's a full spectrum product. It has trace amounts of THC. So if you are working at a job that has random drug screens, then you want to use the product just topically. So again, you want to make sure that whoever invited you on the call, you want to get all of your questions answered if we don't get to them. But yes, this product is used orally as well as topically, and all of the ingredients that Doris went over, black seed, rosemary, pumpkin seed, lemon oil, all peppermint, all of those ingredients are in the bottle with the CBD. So you need to purchase black seed separately, okay? So that is another question. Minister Mooney, I'm going to bring you up next. And then
Can you hear me?
Yeah.
You can? Okay. The product is amazing. I think that for a male, we in the male world, we've only heard of pretty much Rogaine, and that's not Rogaine. That's not really over time, that's just not really the go-to, because it's like a hit or miss. And especially when it comes to beard, guys, this new whole beard era is like, what do you use? What do you use? What do you use? And for 3 years, I wasn't really able to find the right formula to keep it soft. Hair on your face is a very delicate thing. You have to keep it clean, all that good stuff. So one, the oils smell good, which is really what attracted me to, not just seeing the growth, but just after finding something that kept it soft, growing, not having to deal with the Rogaine or the other stuff, it was really a game changer for me. And after seeing that it just worked with more people that I was sharing it with, man, I don't hold my tongue with sharing that it works. So, ladies, I'm telling you that the aromatherapy of this oil is wonderful. If you got a guy, get it to him. I've actually shared with a guy named Michael, who he was dealing at a young age, dealing with male pattern baldness. He's seeing growth. He put it in his hair and his beard and came to work like, check me out, and looking real good and very proud of him. That's the young guy. So get it for your guys as a Father's Day gift. I promise you they'll love it.
Very good. Mother's Day gift first and then Father's Day. Thank you. Thank you so much. LaShon, we're going to hear from you last.
Hi, can you hear me?
I can hear you, yes.
Well, thank you all for going on my lupus hair journey with me. Like Tiffany, I was trying to be very transparent and show photos so people can get a realistic look and know that we are coming sincerely. I know my lupus support group people are on the phone. They've been texting me and they know that I check out things. I try to investigate and find products and find information to share. And I think that's one of the best things that we can do for and with each other is to exchange information. I know a lot of products out there are not designed for us. So I'm very excited that this product is designed for us and helpful to us. So I'm hoping that everyone that is on the call, I saw over 125, 130 people. Yeah. So I'm hoping that tonight will be a nice for hemp powered hair. And if anyone has questions through that lupus support group or that lupus sorority, please reach out to me. I am here for you to answer questions. And thank you so much for having me, Dr. Rita, and all the panelists. Thank you.
We had 140 people on this webinar tonight. This was an amazing, empowering discussion. I want to thank all of my panelists for the time you've spent. I know we're over, but what else do we have to do? We're sheltered in place, right? We have nowhere to go but to another room in our home. And we want you to reach out to the person who invited you. We want to get this product ordered tonight for you. Our fulfillment department will ship it right out tomorrow morning. And we want to, again, thank you for joining. Thank you for listening. Thank you for being patient with us. We want to say good night if there's no other questions. But remember, contact the person that invited you on this line to get your products ordered, to get your questions answered, and have a good evening. Thank you. Good night.
Thank you. Bye-bye.
You guys were amazing.
Thank you.
Thank you. Good night.
No.
Thank you. Have a great night, you all.